Asthma is a chronic inflammatory airway disease with variable airflow limitation, presenting with symptoms such as wheeze or noisy breathing, chest tightness, breathlessness, and sometimes cough. These symptoms change in intensity and can vary day to day or by location, making asthma one of the most common chronic diseases in primary care, especially among children. It is essential that patients receive the right care, so diagnosis should be achieved as soon as clinical and testing evidence allows it, and as accurately and objectively as possible. Because there is no single test that confirms asthma, we build a diagnostic picture over time, much like assembling a jigsaw puzzle. With each appointment, you collect pieces of evidence from the patient's presentation, history, physical examination, and objective tests. Step 1. Gather a comprehensive history that includes personal, family, and occupational factors. Begin by asking the patient, what brings you in today? Do you experience these symptoms every day or intermittently? Are they worse at night or during exercise? When did you first notice your breathlessness? What usually triggers symptoms, or do they persist irrespective of exposure? Are they initiated by infections, exercise, cold air, or something that patients are in contact with that they could be allergic to? Step 2. Conduct a thorough physical exam by inspecting the nose, throat, and skin for any abnormalities, listening carefully to the lungs for wheeze or reduced air entry, checking vital signs such as respiratory rate, pulse rate, and measuring pulse oximetry if available. Step 3. Objective testing through spirometry or peak flow monitoring is crucial to demonstrate airway variability and bronchodilator responsiveness. Spirometry can be used on symptomatic patients to assess FEV1 and FVC before and after bronchodilator use. An increase by greater than or equal to 10% from the predicted value in either FVC and/or FEV1 after bronchodilator administration confirms airway variability and dysfunction, supporting an asthma diagnosis. If the patient is symptomatic, you can also record an initial peak flow, then administer 4 puffs of a short-acting beta agonist like salbutamol or albuterol via a spacer. Remeasure the peak flow after 10 to 15 minutes. An improvement of 20% or more supports an asthma diagnosis. For asymptomatic patients during the consultation, advise serial peak flow measurements over 2 to 4 weeks using a peak flow diary. Alternatively, use the Global Initiative for Asthma (GINA) trial of treatment. Start a low-dose inhaled corticosteroid-containing regimen for 4 weeks. Document baseline symptoms and lung function, then repeat spirometry or PEF at week 4. An improvement of greater than 12% and greater than 200 milliliters in FEV1, or greater than or equal to 20% in mean PEF, confirms variable airflow limitation and supports an asthma diagnosis, indicating the need for ongoing controller therapy. Step 4. Consider alternative diagnoses and be alert for clues that the picture may not fit asthma. Red flags include an isolated productive cough, especially with hemoptysis, weight loss or systemic symptoms suggesting infection or other chronic diseases, findings on examination that point away from asthma, such as signs of heart failure or lung cancer. Finally, remember, diagnosing asthma is often a process of building a diagnostic picture over time. The jigsaw puzzle approach means that you may need several appointments to capture the variability of symptoms and test results. As you gain experience, the patterns become more recognizable, and the diagnostic picture becomes clearer. Once you have assembled sufficient evidence through detailed history, physical findings, and objective test results, document the criteria and the date in the patient's record. Then, initiate guideline-based treatment, such as starting an inhaler, and schedule structured follow-ups to reassess control or revisit the diagnosis if necessary. Now, time to solve a short quiz to reinforce your learning. A set of selected IPCRG resources will be available for you at the end of this breath.